Hello and welcome to Ask Dr. Gupta. In our series of videos on cancer, today we shall discuss a very uncommon but important situation, that is cancer being diagnosed when a lady is pregnant or pregnancy coming when a lady is on treatment of cancer. Pregnancy brings cheers to every family. What if cancer is diagnosed at the same time? It is a dilemma for family, for patient and for the treating doctor. Life of the fetus and that of the mother is at stake. At this time, compromising cancer treatment can be disastrous. Doctor, on the other hand, has to balance the risk to the mother and to the fetus. Many a times, unfortunately, pregnant ladies stop cancer treatment because they feel this will affect the fetus negatively. The concomitant incidence of both the situations is relatively rare. Still, it is not totally unheard of these days. The reasons are twofold. First reason is that cancers are now coming at increasingly early age. Earlier, it used to be said that cancer affects people more than 45 years of age. Today, this barrier has been lowered to 35. Second reason is marriages getting delayed and happening in relatively later phases of life. Because of these reasons, the pregnancies also come late. So both the poles have moved proximally and they have come relatively close. Today we shall discuss the cancers that are relatively common during pregnancy, how does it affect the management, and we shall also be discussing the strategies that are adopted to save the fetus without compromising cancer treatment. First of all, let us discuss which cancers are common in pregnant ladies. Before I start the discussion, I would like to emphasize that pregnancy does not have any role in causation of any of these cancers. It is mere coincidence, and we will be discussing which cancers are more commonly associated in the pregnant stage. Breast cancer is the commonest cancer that comes with pregnancy. The diagnosis of breast cancer coming with pregnancy is delayed in most of the situations because during pregnancy, enlargement of the size of breast, changes in the texture of the tissue are common, and these changes mask the changes that are happening because of cancer. So many times the disease when diagnosed is not in that early stage. Despite being the commonest cancer in pregnancy, breast cancer is still seen in 1 or 2 pregnancies out of 10,000 across various studies. In addition to breast cancer, we can also see blood cancers like leukemia or lymphoma when a lady is pregnant. The symptoms of various cancers are similar to the symptoms seen in non-pregnant or seen in general population, the symptoms that we had discussed in detail in our video on symptoms of cancer. Some situations are incidentally discovered when the lady is being investigated for pregnancy. For example, if an antenatal ultrasound of the abdomen is being done, then it is not very uncommon to see an ovarian mass being discovered in that ultrasound which was otherwise not known to the patient. After knowing which cancer is the commonest, now we move on to the treatment part. Treatment of cancer in pregnancy, like in any other situation, depends on the type of the cancer and on the stage of the cancer. In a relatively early stage and in relatively early pregnancy, surgery is the safest. It can be offered in early days of pregnancy also. But in those patients who need chemotherapies for their cancer, your cancer specialist will be able to guide you about the drugs that are relatively safer. If timing of drug and the type of drug is taken care of, then the risk of congenital abnormalities is almost equal to that of general population. Chemotherapy is not given in first 3 months of pregnancy, and as you might be aware that generally no drug is given during first 3 months of pregnancy. When chemotherapy is given at that time, if any of you has seen someone in your family being treated for cancer, then you must have noticed that the white blood cells go down. So this can happen when chemotherapy is being given in pregnancy also. So it happens that during pregnancy, there is transient drop in white blood cells in mother and in child at the time of chemotherapy. Because of this reason, chemotherapy is not given after 35 weeks of gestation because the baby can be born at any time after that. Here is one question which is interesting and which is logical, that we discussed in our video on the mechanism of action of various treatment modalities, that chemotherapy acts by killing those cells that are growing rapidly because cancer grows faster than normal cells. So a child is growing, it is growing rapidly. So if chemotherapy kills cancer, then how a child is protected? How can a child remain safe even when it is growing fast and chemotherapy is killing those cells that are growing fast? So the reasons are many, but a very important reason is inability of the cancer drugs to cross the placenta and to reach the fetal blood in toxic levels. The passage across placenta varies from drug to drug, and this is exploited by the specialists to give only those drugs that do not cross the placental barrier and are safe for the child. Similarly, the cancer cells, they also cannot cross the placental barrier and the child remains safe. Main fear among families where a lady is pregnant and is being treated for cancer is about the long-term effects of chemotherapy on the child that is going to be born. So let it be clear that long-term observational studies have shown that in children who were born when their mothers were given chemotherapy during pregnancy have shown no deficit as compared to normal population in their physical growth, in their neurological growth, or in their psychological development. Therefore, if someone being treated for cancer becomes pregnant, or if a pregnant lady is discovered to be having cancer, please do not panic. Contact your cancer specialist immediately. The situation can most probably be managed without long-term harms. At the same time, knowingly going for pregnancy when one is undergoing treatment for cancer is not a good idea because organ formation happens in first 3 months of pregnancy. In this time, either the drug will have to be stopped or the pregnancy might have to be terminated. And as I told in the beginning itself, surgery is one treatment that is safe even in early days of pregnancy. With all this information, I wish all cancer survivors and all those who are undergoing treatment a very happy motherhood. My email address and my teleconsultation number is mentioned in description. If you wish to contact me, you are most welcome. If you suggest discussion on a topic, please contact us on our email address. Thank you.